Hello, Miss Jeraneta.
Hi. I've worked in almost every genre of nursing with the exception of pediatrics.
So, what would you say are the key duties for a nurse?
I'm an LPN, so my workload looks a little bit different than an RN. Working in a hospital, once you clock in, you give a report on your patients. I do what we call vital signs. A set of vital signs is blood pressures, pulse, respiration, temperature. In between that, we are doing medication administration. I may be helping my tech to clean my patient. I may be putting in orders for the doctor, charting, because if you don't chart that a task is done, it didn't happen.
So, as an LPN, it seems like there's always a problem to solve.
We are definitely problem solvers, yes.
How do you go about your problem solving in your day-to-day as a nurse?
I know a lot of us have tunnel vision when it comes to problem solving. This is the way that it's supposed to go, but there's not always a streamline to a solution. Get different opinions, ask for help when needed, and also, especially when you're taking care of patients or people in a hospital in general, you want to give them options.
So, what type of formal training or certification is necessary to pursue a career in nursing?
ASN, you're going to be in school for about 2 years. BSN, typically 4 years. LPN, when I did LPN, it was a 14-month program.
So, what recommendations do you have for future nurses?
You have to have empathy. I've been a patient a time or two, so I was very, very, very grateful when the nurses and the caregivers would come in and just empathize that every day is not going to be a good day for me. And so that is my mindset when I go in to meet my patients. I try to go in every room with a smile on my face, try to give them some kind of positive outlook on the day, even if it's the smallest thing. Ask a lot of questions. You don't know if you don't ask. Good communication it's good, but being a good listener is better.
How can you find work as a young nurse?
I promise you, you will find a position. We're still in the healthcare crisis. The world still needs nurses. The world still needs good nurses. You can be a telehealth nurse. If you don't necessarily want to go into the hospital, you can work in a clinic. You can work in long-term care. You can do home health. With nursing, experience comes with pay. So the longer you're a nurse, the more you can expect to be paid. It also depends on the area that you intend to work. You get paid a little bit more working in a hospital as opposed to a clinic or a long-term care facility. Certain places in the hospital may offer a more competitive wage and also your degree of nursing. So me as an LPN, I would make significantly less than a BSN RN.
So, what would you tell someone who's starting their career and all of a sudden they face huge challenges that might make them want to quit?
When I was in nursing school, I was homeless. I lived in a car for 10 months while in nursing school, but I pushed through. You have to keep pushing through. You have to keep going. You can't give up. Be patient and keep going.